Now it's time for our weekend daybreak health segment with men's health expert Dr. Randy Fagin. And since November is Lung Cancer Awareness Month, we've got some questions about that disease this morning. Good morning, Dr. Fagin. Thanks for joining us.
Pleasure.
Now, I know we all live in Austin where allergy issues are high. Can you speak to a few overall lung health issues that affect men?
Sure. You know, there's some genetic problems that folks can have with their lungs that actually affect the way they function. And sometimes the cells make too much mucus, or they're too small, or the little hair follicles that help to protect it just don't work the way they're supposed to. And when that happens, you can get chronic bronchitis, allergic bronchitis, emphysema. Essentially, we're not able to transport and absorb oxygen the way we're supposed to, and that leads to the symptoms that we have.
Now, are males or females more likely to develop, say, asthma?
Yeah, you know, it's interesting. There was a study put out by the American Journal of Respiratory Health and Critical Care, and what they found was in boys before puberty are more likely to get asthma, but girls after puberty are more likely. Now, we're not sure whether it's the rise in estrogen and progesterone that can protect women or the rise in testosterone that protects boys. Either way, it kind of flips when puberty happens.
Now, in September, the American Cancer Society released a report that had some disturbing news about lung cancer in men. Can we talk a little bit about that?
Yeah, no, lung cancer is the #1 cause of cancer-related death in men. Over 1 million cases diagnosed worldwide. About 80% of those cases due to smoking, but 15% of them in non-smokers. And what's really disturbing for men's health is in male non-smokers who get lung cancer, they are 25% more likely to die as a result of their disease as opposed to women non-smokers who get lung cancer.
Well, what can you do? How can you lower the risk?
Yeah, since over 80% of these cases are due to smoking, smoking cessation. Stopping smoking is the most important thing you can do. And regardless of how much you smoked, when you started smoking, you can stop today, and every year that you remain smoke-free, your risk of lung cancer drops.
All right, well, that's definitely good news, but let's switch gears a little bit and talk about what happened with 67-year-old U.S. Attorney General Michael Mukasey. He collapsed during a speech Thursday night. He has been given a clean bill of health. One aide said it was nothing more than a fainting spell, but something like this, what can bring on these symptoms? Yeah,
I mean, the most worrisome thing, the most important thing to diagnose is a stroke or a TIA. Now, these are kind of linked. Stroke is more serious. TIA is a little bit more kind of a watered-down version. If you watch the video of him, he actually starts to stutter. Then he starts to drop to his right-hand side. There's almost a facial droop on the right. These are the sort of things that we need to look for the possibility of a stroke or a TIA. Now, when a stroke or a TIA occurs, it means there's been a lack of blood flow to a part of the brain. And when that occurs, a stroke means that it's happened for long enough that there's actually permanent damage. It leaves a footprint. If you do a CAT scan or an MRI, you see an area of damage. Whereas a TIA, the damage hasn't occurred for long enough to leave a permanent footprint there. So the person has the symptoms and then gets better and recovers fully. Signs of a stroke, really important things. People who have trouble finding the right words, they start to slur their speech or have trouble grasping the right word to say. People who have difficulty with weakness, specifically on one side of the body. All of a sudden, like our Attorney General, dropping to the right-hand side, specific weakness that is on one side of the body is a sign. Difficulty with their motor ability or walking patterns, that happens all of a sudden. That's also a sign that can be worrisome. Also, visual disturbances. People who have sudden onset of difficulty seeing, that can be a problem. So, walking, talking, unilateral or one-sided problems with their motor weakness or visual disturbances, signs of a stroke. Really important, diagnose it early, got to get the person to the hospital. Minutes matter when it comes to a stroke.
That is correct. Dr. Fagin, thank you so much for being with us this morning. We appreciate it.
Pleasure.
Great information. And we will have Dr. Fagin on every other week. If you have a question for him or a topic you'd like him to discuss, log on to KVUE.com, go to our web link section, and ask your question on Dr. Fagin's website, and he will answer it in the coming weeks.